you doing?
Hey, Karen. How are you?
I am doing well. I'm so glad you're here and you have your pets with you. Yay. So they may become a part of the podcast. My pet, my dog, Obi, is in the other room. She may start barking and who knows, join in. So that's the way it rolls here. We're just like all homey and friendly and stuff.
I love it.
Yeah, and we are so homey and friendly. I do not do bios or introduce people in the most traditional of ways. So why don't you tell us a little bit about who you are?
Sure. My name is Talid El-Sabawi, and I am an assistant professor of law. I'm at Elon University right now, and I will be making a transition to Florida International University's College of Law in the summer. So I have a PhD in public health, health services, research, policy, and management, and I focus on policy. I have a doctoral cognate in political science. So that's where the policy and politics comes in.
Wow. So how did you even get interested in, well, first of all, talk about some of the research you do, and then I'll ask you how you got interested in that research.
Sure. So I say I do addiction policy research and mental health policy research. What I mean by that is that I look at how policies that are created to address mental illness or substance use related problems are formed, how they're developed, how they are pushed through the policy process, how they're implemented, if they work. I do also some legal drafting. So I've written some model laws, and I've been doing more of that lately in advocacy work. And so really I'm at the intersection of public health, law, and by force, the criminal legal system, because I didn't set out to do the criminal legal component, but it just keeps popping up because of community collaborators I work with and the ways our laws are structured.
Mm-hmm, mm-hmm. And how did you get interested in this? Like, and I know some of it is by force, as you say, like sometimes we fall into what we're doing, but was there also from your perspective, like, wow, I'm called to do this work?
Yeah. So, when I started my bachelor's, I thought I wanted to be a business major, but then I kept trying all of my solutions to the problems that corporations were facing was like, why don't we just give employees ownership of the company? And, so I kept trying to socialize things. So I realized pretty quickly that business probably was not a good major for me. I took some classes and I just fell in love with psychology. So my bachelor's is in psychology. And as a psychology undergrad, I did research with professors. And one of the professors I did work with was a JD PhD. And he was a developmental psychologist, and he had his JD. And he did work with foster children to kind of understand temporal memory and how much we can expect them to remember as witnesses. And I did the interviewing for him, and I really enjoyed working with the foster children. And eventually I thought I got what I thought I wanted, which was this full-time gig representing children in foster care. And as I'm representing them, I'm realizing that, I need to focus on policy because this case by case effort is not going to work because the system is completely broken. Yeah. Right. And so that's when I had kind of a switch, and I said, what, I'm going to look at mental health and addiction policy. And I was going to focus in mental health policy because I did and still do believe that there is a large, one of the biggest concerns I always had was that both parents and children never received mental health counseling or treatment, despite the trauma that clearly was happening just by them being involved in the process, right? And it always shocked me. We would send parents to drug court. They would have to, pee on a stick or whatever. We'd care about abstinence, but they never got mental health treatment, which just blew my mind because these are people that had suffered from sexual traumas and so I was kind of passionate about that. So I went to get my PhD, and I was going to focus on psychology, but I had a great professor from law school who was the only Black professor that I had as a law student. The only professor of color I had as a law student. And he remembered me. The others didn't, or refused to write me letters of recommendation because I got a B+ in their class or a B instead of it. Now, mind you, this is like years later after I'm a barred attorney in 2 different states, and I still couldn't get letters of recommendation from. So anyway, this professor was like, all right, I'm going to help you. If I need to call schools to tell you to let you into their PhD program, I'm going to do that. But you need to apply to public health and not psychology. And I was like, I don't know about this. I've always wanted to do, and so he's like, no, trust me. And so I said, okay, well, this is the only person who, my academic career that is still willing to support and go to bat for me. So maybe I should at least apply to a couple of public health schools. And after I did the research, I was like, actually, I can do exactly the type of research I want to do in public health, right? And it is not focused on the individual. It's population-based, which is I'm much more interested in. And so I did that. And I ended up only applying to public health schools. And he did, when I got into the PhD program at Ohio State, they told me one of the reasons I got in was because my letters of references were so good. It felt like they knew me. And so, I know it's from the support that I got from him and from a couple of other folks. So that's how I ended up kind of on this track. How I ended up doing addiction was even more focusing on addiction was that my dissertation chair, she is a expert in mental health policy. And she is, was part of the peer respite movement. I mean, she has kind of been around, and I was her last student before she retired. So, she's a tough cookie. She got her PhD from MIT, and she's a political scientist and in a public health department. But, I was like, if I'm going to ever graduate, the point you graduate is when you know more than your dissertation chair does, right? And they can admit that you know more about that one thing. And I was like, what am I going to pick in, mental health policy? So I said, you know what, I'm going to focus on addiction because nobody's looking at addiction. And at the time, 2014, right? Nobody was looking at addiction policy. And so I found like one of the few classes on it in the social work school to take some classes with the social work student, understand how they treat addiction. I had to make my own reading list because nobody was writing on it at the time. And then, so I kind of got in there and I was like, this is really fascinating. So, and she always taught me, you should never propose a policy change until you understand how we got here.
Oh,
so she would make us read all of the policy history, right? So I was like, guess I have to go back to the 1700s, right? So that's what I did. I started the 1700s, and so that's kind of how I ended up here with this, this particular specialty.
You were talking about there are a couple of things that have happened since that time, but that are kind of timely. But before I go into a timely thing, on the panel, you were talking about model legislation for behavioral health crisis response. Is that right? Yeah. Okay. Because I think, this is where the world is focused right now. Everything is on, the 988 number and reforming behavioral health or mental health crisis systems. And the way that we generally do that, I think you gave some really good examples about sort of looking at policy and the history. Where the heck did this come from in the first place? And we don't spend a lot of time doing that. We sit on the policy where we're now today and then move forward off of that without understanding the foundation under which, where the heck did that come from? Everybody's looking at, implementing programs. Well, if we could just implement this program or take this program from there. But I like how you were framing this idea of, look, policy is the thing, or legislation is the thing that is going to institutionalize it, not the program itself.
Right.
So can you talk a little bit about that?
Yeah, sure. So let me kind of explain why we drafted the model law and why I thought it was so important and dedicated a very concentrated amount of time to get it written quickly. So the Greensboro Homeless Union came to me when I had just started working at Elon University, and they asked if I would help them, and they it was their idea actually to have a CAHOOTS-like mobile response here in Greensboro, North Carolina. And they were proposing it in remembrance of one of their associates, Marcus Dion Smith, who had been killed here in Greensboro, North Carolina by law enforcement when he was amidst a behavioral health crisis. And he was a Black man that was killed through the use of a rip hobble restraint as they were trying to subdue him. And, he didn't have a weapon. He was not a risk to safety. He was banging on the police car windows when he was trapped in the police car. I mean, that was the extent of. And so, we started trying to figure out, all right, so this is how politics works. This is how legislative behavior works. I've written about legislative behavior a bit. And there just wasn't political momentum to have a non-police response. So Greensboro went with what I'm seeing as kind of the most common initial responses. Let's train police officers. That's response number one. Okay, you don't like that or that doesn't work. Well, let's send trained police officers plus a clinician, maybe duly dispatched, maybe dispatched after 5 hours, whatever guess what, that didn't work either, but they didn't want to leave $500,000 taxpayer dollars later. And so there just wasn't any appetite for it. And then we had this focusing event that focused national attention on police use of force against Black persons that results in death and other harmful consequences. And we know that George Floyd wasn't the first, nor will he be the last, but he was the focusing event, unfortunately, just because of the media coverage and the Black Lives Matters protests that resulted, that demanded change. And I said, this is a political window of opportunity. There is political appetite right now. We need to make sure that we do it right. We need to take advantage of this political moment when legislators are being forced to do something and make sure that what they adopt is something that is true to the community, that is not diluted, that isn't co-opted by law enforcement or clinicians, that it doesn't turn into another forced mechanism of forced institutionalization. And I said, let's write the only law on non-police behavioral health crisis, and let's write it so that it is community-centered. Through all that feedback, we put it in and included things that were important to community members. I tried to keep the power with the community by creating an advisory board that is not appointed by the city government or county government, that it would be a public application process rather than an appointment process. And so the idea is that it's not heavily experts or heavily, law enforcement or clinician, that it is mostly, and they have the power of the purse, the ability to vote no on a budget, which is pretty powerful. Anything having to do with money in politics is powerful. So the idea was, if it is in law, then it is a lot harder to get rid of it.
I love it. I love it. And I'm curious, as somebody had asked me, it was somebody from the provider guilds, and they said, what did I think about the CAHOOTS model? And I said, oh, this is interesting. Okay, mobile crisis, and it's not a co-responder model. And I said, but wait, where is this? Right? He said, oh yeah, it's in Eugene, Oregon. And I'm thinking, wait a minute, Eugene, Oregon? Let me go check the demographics of Eugene, Oregon. That's just me. I just I'm very contextual. So I was like, let me understand where this is happening, that people just want to lift up and expand as is in other places that may or may not look like that particular place. The person who was asking me happened to be African-American. And so I said, have you looked at the demographics of Eugene? No. And I said, well, you look it up and you tell me what you think. And they were like, oh, holy heck. And I was like, yeah, it's about 2% African-American. I mean, I think that's probably an under representation, whatever. It's a really small number, in other words. And so I started to wonder, But how do we know that there are still not disparities happening even with mobile crisis for this small group of people? And I'm not saying no to it, and I'm not saying it's a bad idea. I'm saying, how do we understand it in the context of the community? How does the community get to define that, yeah, this would be good for our community or not? And then, like you're saying, how does it become something that is sustainable over time, especially if it's working, or if it needs more time to be tweaked and work, because sometimes you just set it down there, it's not going to work right away, right?
Right. So I think that component, we tried with the reporting requirements. One of the things that, we encouraged was demographics, but the issue comes in is that you have to get the 911 data to figure out who is it, because we know that your research shows that how a call is dispatched predicts whether there is going to be excessive or use of force, whatever whatever you want to call it, by law enforcement. And so I don't doubt that this has the potential to turn into or to be reflective of our society as it currently is. In the least, it's a new institution, so it doesn't get the institutional baggage of law enforcement or social services or the other potential agencies that could respond. So our model is a non-clinician model. We do not include a clinician on the response team. It doesn't mean that a clinician would, just like CAHOOTS, there is a clinician that is at the clinic, but not in the response team.
Right.
We wanted to be able to define at a later time what a de-escalation or behavioral health crisis worker could be. We did that because we felt that Eugene is a very unique environment. And we wanted to make sure that even in other jurisdictions, that there would still be an emphasis on autonomy of the person in crisis. And we didn't want the person who was the de-escalator to be wearing two hats. We also did not want to use peer support because in the substance use treatment space, it has a very long history of being associated with certain types of recovery communities. There are states that define in law what a peer is, and it's a credentialed position. And we didn't want to get any of that baggage. So we're really trying to find something new, and we really would love the community to staff the team.
So something like a mental health first kind of response that's in Sacramento and Oakland, that's community-based. There's no co-responder, there's no clinician. Even though somebody may be a clinician in training, they're not operating out of that clinical role. They're operating out of that I'm a community member role. And I think that's interesting, because peers can show up in lots of different ways. They can be credentialed, they can be mutual aid where there's no credentialing, no formal training. And I guess we're also trying to figure out like big P, little p, as I call it. So little p meaning sort of, I'm like you, I've been through this like you, and I'm here to kind of like help you see that I'm not going to be like, the clinician. I'm not that, and I think, and this is where, I'm also on the board of the National Association of Peer Supporters, is like, where is the balance between sort of the credentialed, quote unquote, professional workforce? Where is that? And the co-optation of that workforce to do things that look far more clinical, if you will, or medicalized, even though we are much more kind of in the supportive recovery, supportive role. It is sort of this weird kind of balance, and I'm still appreciating it because sometimes I don't even know what's right. And for me, it's kind of like, well, again, maybe the communities have to decide, as long as it's not a decision that's based on the need of the service recipient, for lack of a better way of putting it. Not
so what we did was to kind of put a little bit of guardrails around it. We defined behavioral health consumer as somebody with lived experience with the behavioral health treatment system, whatever that looks like, because the point of that role is to, help somebody understand their options, help them figure out how to navigate things. And so it was a very specific type, and to know, to focus on patient autonomy, which we or, person autonomy, which we mentioned multiple times in the law.
Yep.
But we also wanted to make sure that, again, it would be low. So we require them to provide information about medication for opioid use disorder or other medications and harm reduction services. We're pretty explicit about it because it has been excluded for decades. So we felt the need to be explicit.
And you just went down the
harm reduction bandwagon.
Rabbit
hole.
The rabbit hole of harm reduction. And I think I read somewhere you're a harm reductionista.
Yes.
So I have two questions. One is going to be about harm reduction and where we are with that, which is kind of like not everybody, but a lot of pushback around it. But also, what is the uptake on the model law? Are people using it, or people trying to figure out how to utilize sort of the work that you all have done?
That's a great question. And somebody else asked me about implementation of it the other day. And I said, we haven't had time to track the so we haven't looked to see who has adopted it. I suspect, I did get contacted by somebody I went to law school with who is a legislative aide for a high-ranking member of the House. And they were like, oh, this is too late. I went to law school. So it got to Congress somehow, right? So I wouldn't be surprised if parts of it are copied and pasted. What we have seen when we've tried to advise local governments is that there is a lot of pushback to the advisory board power. And so they don't want, they want to be able to appoint the people on the advisory board. That is a big piece. And then there is wanting to add a clinician to the team is a big piece. So I don't know who has adopted it with Fidelity. I know that we've had thousands of downloads, which is really cool. And I know people have read it. I know they have it. I know they probably copy and paste parts of it. So yeah, that's been a big barrier. But
at least it's there. I think that's the start, to have people thinking even differently and using tools to drill down deeper and start in a different place than where we generally start, which is CAHOOTS or co-responder, or it's like, well, maybe there are still other options here, especially ones that can help things be sustained, right? And then now I don't know if we're going to have enough time to talk about harm reduction. This is like
I could talk about harm reduction for hours. So
yeah. But tell us really quickly, what's going on.
Break this up into 2 episodes. You know what I mean?
Yeah.
This part, and then we're going to talk about the Crack Act and the Pipes Act now. So
you know what? So fill us in, and I don't know how far we'll get with it, but Look,
I was sitting here working on my grant application. It was due Monday. I picked my head up and I'm like, why is everybody talking about crack pipes? What happened while I was in the hole submitting this? I look up and I'm like, what legislation? What is going on? So I have a paper that didn't start off focusing on this, but ended up becoming a paper on middle-class white exceptionalism and drug policy. It builds on Helen Hansen's work and others that talk about kind of the white opioid crisis, but it talks about it in using a political science or policy lens. And it points out that not only do we still have these different responses in the media or so forth, but our policy responses are still different. I talk about things like drug-induced homicide charges, and my co-author, who's an expert on prescription drug monitoring programs, talk about how those are racially biased. And so we talk about how it's morphed, but it's still the same, where we paint people of color, especially Black persons, who use or possess drugs as deviants. So what happened was I think it's the Washington Beacon. They had a piece that said that the Biden administration was spending $30 million on crack pipes. The $30 million they were referring to was money that was set aside in the American Rescue Plan that was going to harm reduction groups. So for the first time in history, we have money that's explicitly set aside for harm reduction. It was a big victory for harm reduction. So let me back up and talk about what harm reduction is. So what is harm reduction? Harm reduction is the idea that people should be met where they are at, and that we should help them reduce the harms of whatever their choices are, or their behaviors, until they are ready to receive treatment or to stop those behaviors. So that is, it is this idea that we haven't given up on people, and we need to keep connection with them, even if they're amidst chaotic substance use, or even if they, choose to be unmedicated and to live, outside, because that is their choice. We don't give up on them in a sense. We still think we think they are worthy of love. They're humans, and we should help them stay healthy in all ways that we can. So former director LaBelle was able to get members of Congress to agree that there would not be this ban on that funding that was in the American Rescue Plan, which was huge. And so everything's moving along. And then it's about time for SAMHSA, which is the agency that is overseeing the SAMHSA is getting ready to award these grants, or the application deadline or something like that. So then the media, well, at least one little paper, perks up and says, I've heard different things. And I haven't looked into it, but essentially, so there's usually kits that are handed out by harm reduction groups, and they can be kits for people who inject drugs and smoking kits for people who choose to smoke drugs. Now, we know that, this is a proven fact, that crack has been associated with Black persons.
Yeah.
And so have crack pipes. All right. Pipes are used to smoke methamphetamine too, right? So it's not only crack. You can smoke heroin. So the pushback has been, oh my God, the Biden administration spending $30 million on crack pipes, because supposedly in a Q&A session, there was a question that was asked about whether the money could be used to pay for pipes. And the law does not ban it. So of course, SAMHSA was saying, if this is true, if this is what happened, then they would be correct in saying that the law allows it, because the law does allow it. It's pretty clear on its face, right? So Congress getting all up in arms now, it's like, you just passed this legislation. Or it was in there. You should have read more carefully before you signed it, right? So there's bipartisan pushback. So let me be clear, though the bills that have been against it have been spearheaded by Republicans, there's bipartisan pushback. And so the Washington Beacon writes a story about the Biden administration spending $30 million on crack pipes, which I did some research on.
It's like sensationalist, right? It's totally to evoke an image of what the public might think of crack pipe users, not pipe users, not smoky, but crack pipe, which then goes to, we are back to criminalization of
prohibition, right? Like we want to. So, it is a racial trope. So, Drug Policy Alliance has put together a great letter that talks about these racial tropes that are used, the crack pipe, and, crack as a particularly nefarious drug, right? It is a myth. So the narrative then becomes Biden is giving out crack pipes to people, and the prohibitionist in us all as Americans are like, what? The government, it's my tax dollars are paying for people to use drugs. That's the visceral reaction. And we're like, no, let's explain what harm reduction is. And great, but it is too late, right? The crack pipe narrative is already out there. And Marco Rubio first introduces a very racist bill, because it is called the Crack Act, and it bans the use of ARPA funds, which the American Rescue Plan funds, for the purchase of crack pipes or other cylindrical objects. That didn't receive bipartisan support, probably because the Democrats were like, why are you targeting crack pipes? And why did you call the act the Crack Act? But we know the opioid crisis is considered a white crisis. So let's call it the Pipes Act. So he gets Manchin to jump on, and he introduces a second bill that it has bipartisan support called the Pipes Act. Bans the use of ARPA funds for both needles, syringes, and pipes and other cylindrical objects, right? But there is this exception for the syringes only. There is an exception for states that have been classified as the CDC, have gotten CDC permission to be in the state of emergency, right?
Yes.
It's only for the syringes. not for the pipes. And so it's very sad when it gets turned into this whole, well, all this is just enabling. And it's like, no, we're helping people. We're helping. And look at last year, we had the most number of overdose deaths of the overdose crisis.
Yeah. First of all, yes, you heard me kind of groan and moan as you were talking, only because, as a Black person in America, it's like the system is designed to do what the system exactly is supposed to be doing, especially for Black folks. That's the way I feel. And I'm talking about a feeling based on, these kind of policies and sort of what's being communicated and how it's being communicated continues to say, well, Black people, really, we don't give a shit about you. Thank you very much. I'm just going to be blunt about it. And people can agree or disagree, but that's the message I continually get. And I'm an older person. I worry for our younger folks who may be receiving this message. And then how does that get internalized in their understanding of their own self-worth? So we have to continue to work doubly, triply, quadruply hard to make sure that people know that they're loved and they're worthy. And so I really love what you said about these sites being places of love. I was just in another meeting today where somebody was talking about the importance of love, the importance of connection, the importance of relationship. And for many, many people who are struggling with mental health conditions and substance use conditions, that's been broken somewhere, and or other traumas exist that get ignored. Nobody's paying attention to that. It's like, just get off the drug, well, wait a minute. No, where is the love? Where's the connection? Where's the community? Where's the relationship? Where is all of that kind of stuff? And here it is being handed on a silver platter, but people don't see that as the necessary target. They see something else as the target, meaning, don't give them stuff to help them in their lives, make them ready. Like,
make it harder for them to use drugs. Yeah. But it doesn't make them harder to use drugs if they don't have the, you just, but it's been kind of great about here in North Carolina. What I've loved is that there is a large church coalition that has harm reduction services, that has syringe service provider, syringe services. And one of the big reasons they do, it is it's a Christian thing to do for them, right? That is how they see it, is that they are helping their community. They are helping people most in need and showing them that they are not forsaken and thrown away. So it really is something that could be bipartisan and we could all get behind. And I put together some scripts and how to, and I'm trying to really push everybody to call their senator and say why they should vote no, because harm reduction has been quiet. We've all been quiet, right? We'll call about the ACA, right? But nobody calls about things like this. And it's I get it. It's because we feel like our senators won't listen. But guess what? If you blow anybody's phone up and you fill up their voicemail box, they listen, right? They might not vote differently on this bill, but when the next bill comes around, they're going to remember this. And so we really need to all get together. It takes 5 minutes. Call your senator. I had scripts to put together. You can pick one. I worked on them with a bunch of advocates and community groups. And so you find one that speaks to you and you just leave a message or talk to the aide and you tell them why they should vote no. Members of Congress, senators need to at least know we're watching. And we're going to hold them accountable.
Yes, exactly. And it just feels like on the heels of, CRT, on the heels of, social emotional learning. And now this, it's kind of like, really, enough already? Like, hello. But I just have to say that, first of all, that, there were times when, you couldn't see, but, there was as I call it, snapping, clapping, thumbing up that, because it was just like, this is so on point and I think so helpful for people to, number one, have resources. So kind of finding some of the resources that you've, created for folks and using those and, kind of, again, you don't have to follow them to the T. That's not the point. The point is, here's the information for you.
Just making it easy for you. If you don't want to do anything, you don't have to. Just read off the paper. Right.
Yep. So I think, this conversation has been just so incredibly, first of all, informative, powerful, meaningful, timely, awesome, snaps, claps, everything. And, there's just more work to be done. And I'm glad you're one of those folks along with others who are doing this work. So
listen, I gave it to my dog sitter today, and I told my mother and my grandmother that they need to call, right? And that's what we need to start doing, because angry moms scare politicians. Right?
Yeah, well, yes.
There is empirical evidence that actually shows that angry. No, I'm just kidding.
Oh, there should be empirical evidence.
I know, right?
Right.
Yeah,
so thank you, Talib, for joining for the conversation. And
thank you for having me.
This has just been more than I would have even imagined, and just want to thank you and remind our listeners, hey, you know where to find us, and make sure to listen into Unapologetically Black Unicorns next week.